Clinical Pearls, brought to you by Medicom Oncology.
Welcome to Managing Myeloma. I'm Dr. Jacob Laubach, and I'd like to briefly review whether or not you should be concerned about second primary malignancies associated with lenalidomide maintenance in the transplant and non-transplant settings. In the post-transplant maintenance setting, two randomized clinical trials, the IFM 2005 and the CALGB 100-104 trials, demonstrated an increased risk of second primary malignancies in patients who received lenalidomide maintenance. The risk was 8% for those who had received lenalidomide versus 4% for those who had received placebo, or essentially a doubling of the risk. And it's notable that these cancers were both hematologic in nature and solid tumors. It's also important to note that in both of these trials, there was a progression-free survival benefit associated with the use of lenalidomide, and that in the CALGB 100-104 trial, there was a significant overall survival benefit. It is, of course, very important for patients who have undergone transplant and are making a decision about whether to proceed with lenalidomide or other maintenance to understand the rationale for, as well as the risks associated with maintenance therapy. Second primary cancers in the case of lenalidomide, but also other potential risks. It's been my experience in the clinic that data on the risk of second primary cancers affects patients differently. Some patients are very concerned about the prospect of developing another cancer, even though they have a relatively low likelihood at 8% of developing such an issue. Others view this as an acceptable risk, recognizing the benefits conferred by the use of lenalidomide maintenance. At the end of the day, we make these decisions together, and if a patient cites significant concerns about the use of lenalidomide maintenance, we pursue other options. On the flip side, if patients view this as an acceptable level of risk, we proceed typically with lenalidomide maintenance. The key thing is to be working in collaboration or conjunction as a team between the patient and their physician.
Don't forget to subscribe to the Medicom Oncology podcast channel for more clinical pearls. And be sure to visit managingmyeloma.com for more practice resources.